Good afternoon, everyone. Thank you for attending today's meeting to agree the scoping document for review into carers and respite. I'm Councillor Kirsty Mellor, Chair of the Housing and Social Care Scrutiny Panel. Just a little bit of housekeeping information before we proceed. If the continuous fire alarm sounds, please evacuate the room and public gallery by the stairwells. Do not attempt to use the lifts. Please assemble by Queen Victoria's statue in Guildhall Square. In order to comply with the Guildhall Trust fire marshal regulations, anyone who signed in at Guildhall reception desk should sign out when leaving the building at the end of today's meeting. Please can everyone use the microphones if they're going to speak, and remember to switch them off when they've finished. Thank you. So on that note, we'll just go around and do some introductions. So I'll start to my left, Andy.
Thank you, Chair. Good afternoon. My name's Andy Biddle. I'm the Director of Adult Social Care at Portsmouth City Council.
Thank you, Claire.
Hi everyone, I'm Claire Ratchwell, Deputy Head of Service in Adult Social Care for Market Development and Community Engagement.
Thank you. Over to you, Maria.
Maria Cole, representing the Residents' Consortium.
Sue Gordon from the Residents' Consortium.
Thank you.
Same again, Felicity Goodyear, representative of the Residents' Consortium.
Thank you for coming. You're most welcome. Councillor Brown.
Councillor Stuart Brown, Fratton Ward.
Councillor Madden.
Leo Madden, Lib Dem, Nelton Ward.
Thank you. And Councillor Symes. Thank you. The next item on our agenda is deputations, and because we're a scrutiny panel, we don't have any deputations here today. We'll move on now to apologies for absence. I've had one from Councillor Graham Heaney. Are there any other? And Councillor Scott Pater Harris. Are there any other apologies that have been sent in? No. Okay. Thank you. Okay. Now on to declarations of members' interest. Are there any declarations, please? Excellent. This is going to be a very quick meeting, I think. Okay, so we're now on to approving the minutes of the previous meeting. Do panel members recommend that the minutes of the previous meeting held on the 24th of March 2022 be agreed as a correct record? And does anybody have any comments, please? Down to Linda and Stuart, yes, please.
They look fine to me.
Excellent, thank you. So in that case then I will now approve the minutes as a correct record unless anyone has any objections. Clearly not. Thank you. Okay. Just on that note, I just wanted to say thanks to Councillor Corkery and the members of the panel and the officers for their review into procedures and performance of the Council and Housing Associations in relation to responses, repairs and maintenance. So thank you very much. So we're here today, obviously, to discuss our draft scoping document for review into carers and respite. The panel informally agreed to undertake a two-part report, the first being on the recruitment and retention of carers, and Andy has kindly sent round some background information and data on care recruitment, and I hope you've all had a chance to read this and look at the figures for Hampshire. There was a hyperlink included in that, and it's my understanding that the figures will be updated this October. However, as it stands, there are currently 2,900 vacancies in Hampshire, but I'm hoping that you'll be able to correct me if I'm wrong, Andy. But I'd like to hand over to you, Andy, to give us a brief talk through that, please.
Certainly, thank you, Chair. So this is data compiled by the organisation Skills for Care. It's compiled, it comes out twice a year, rather oddly. The first release tends to be national data, and it comes from something called the Workforce Data Set, which is gathered from local authorities and from providers, care providers up and down the country. So we get an overall national picture, usually about the beginning of September or the end of August. I think this last one was published. And then we get a more localised picture in October. So it's not until next month we'll be able to see the Portsmouth version of this data. So the latest data that we've had, as you can see in front of you, the total number of posts in adult social care in England is about 1.79 million, so it's a bigger workforce than the NHS. And that's about a 0.3% increase on 2020-21, which was the last time it was measured. The really important thing, I think, to focus on is that the number of vacant posts within the social care workforce in the country, and that's about 165,000, which is very significant, and that's gone up since the last time it was measured by about 55,000. The concern is that is down to recruitment and retention difficulties. I think it's probably fairly well rehearsed in the national press, certainly, and local commentary in this chamber around the difficulties with recruitment, with pay, the competition for those people that would naturally go into working in care with higher pay and better conditions in, for instance, supermarkets and retail in other sectors. And so that appears to be reflected in these figures that we've seen. We saw a significant impact of the COVID-19 pandemic, as we did in the NHS. And again, we've seen certainly national reportage about the number of posts that have become vacant in the NHS throughout and then toward the end of the main thrust of the COVID pandemic. And that was pretty much the same in social care. So the actual number of people working in adult social care, so the number of posts is higher, but the actual number of people working in social care is about 1.5 million. And an estimated 17,900 organisations are involved in providing or organising adult care. So whereas we've got a brand and de facto a single organisation with the NHS, we don't have that in social care. It's often a collection of smaller organisations in the area. They'll be doing a variety of things. The two that immediately stand out are providing care home care, mainly for older people with age-related disability, but often for working age people too, or domiciliary care where people are coming into people's own homes, residents' own homes, to help them with care tasks. But there's also a wider range of adult social care environments, supported living, for example, where you may have your own front door, but you're living within a complex where you have care on site. Extra care, which focuses particularly on older people who gain a tenancy and live in that similar environment. We also have day services, so meaningful activities during the day, and respite services. So those are the broad categories of care that are provided. And respite, of course, is something that we're going to come on to and talk about in this session. So the important thing to note about the figures that we've got is that the majority of unfilled posts are in residential care homes and residential care homes that provide nursing. But there have been quite a significant reduction in filled posts of about 19,000. That's about 3% of the workforce in non-residential services. So that's people that are coming into your own home or people that are supplying care to you as part of a complex where you live. We are finding particular difficulty in filling qualified nursing posts. So whilst social care doesn't generally employ qualified nurses, within nursing homes, care homes with nursing, nurses are employed. And so there's a particular difficulty in recruiting nurses, which is reflected in what our health service colleagues are telling us up and down the country, that they're finding it very difficult to recruit nurses as well. So that's a broad summary of that data. That's, as I say, that's the national report that we've received. We'll expect to have a more localised picture for Hampshire and, in fact, down into Portsmouth numbers in October, and we can circulate that as soon as we get it. I think the publication date may be around the 20th of October, but I'm not 100% sure. I'm happy to take any questions or thoughts or comments around that.
Thank you very much, Andy. Do panel members have any questions for Andy at all? No? No? Anybody from the Residents' Consortium? Maria, yes, please.
Yeah, I'm not sure whether it comes under what you've just been speaking about, but do you know what about child carers who are children? Do you have any connection with them?
We do work with young carers in the city, and I think Claire could probably give you a more accurate update than I can in terms of detail. This kind of data, though, only reflects people who are in paid care. So whilst we work with a huge amount of unpaid carers, and in fact the health and social care sector wouldn't be able to exist without unpaid carers, which is what we're here to talk about today, this data purely refers to paid carers, but I don't know if Claire might want to say something about younger carers.
I don't have any data in front of me, and actually accurate data on the number of young carers in Portsmouth is kind of hard to establish at the moment, but that is going to improve soon as young carers questions have been added into the school census. So in terms of how adults and children's services work together, through the carers service, which is part of adult social care, we have good links into the young carers service and children's services. You may know some of the young carers activities are actually situated at the carers centre, and we've maintained really good links with staff, although they've not, 5 years ago they went into children's services out of adults, but we've really been able to maintain some really good working relationships and making sure that whole family approaches are being taken where possible.
Thank you. Any further questions at all? No? Okay, thank you. Thank you again, Andy. So following on from this, and as a result of the recruitment crisis, we've got 6 million adults in Britain who help care for members of their family or friends, and this work is unpaid and is saving the government millions of pounds. And unpaid carers often work beyond the average 37.5 hours per week, and caring for somebody can have a toll on a person's emotional well-being, and often carers report that they feel socially isolated, that they lose contact with their friends, etc. So I welcome this report, and on that note I'm going to pass over to Claire, sorry, I nearly got your name. I wanted to call you Rachel because I get very confused with your surname. Over to Claire to give us an overview of the information that she sent through to us. Thank you.
Okay, so I'm going to talk a bit about carers' breaks, which I think that will kind of inform the conversation today. So carers actually save the value of the care that carers provide, unpaid carers, is actually £193 billion. It's roughly equivalent to the cost of the NHS on an annual basis. So, you know, the whole care system, the whole NHS would absolutely collapse without that support that's being provided. And obviously carers, in the way that society is diverse, carers care in hugely different ways. It might be providing emotional support or help with organising yourself or medication, but sometimes it's also personal care and more practical support. Obviously that's very common. The pandemic has had a huge impact on the number of people who are caring and the complexity of the care that's being provided. So more people are caring, and those carers are doing more caring than they were before the pandemic. This has obviously coincided with some of the things that Andy's just been referring to. So we talk about breaks for carers as a very kind of general thing. A break can mean anything from having help to work out how you can have some time out for yourself in your daily life as a carer, all the way through to providing replacement care. So to do whatever it is that you need doing while you're not delivering that care yourself. So for some people that might just be an hour or two every now and then. It might just be a little bit of replacement care so that they can go to doctor's appointments and things like that, the necessary stuff. But there are obviously lots of people who are caring for people 24/7, where they might have interrupted sleep. They might not be able to have any kind of significant downtime themselves, just to do the things that we all need to do to stay well. And that's where often the care market, the paid carers that we've been talking about, will come in. So through adult social care or privately, people will arrange to have that replacement care provided, very often by a domiciliary care provider, but also sometimes through a residential or nursing provider for an overnight kind of break or a longer break. Sometimes people need those longer breaks just to stay upright because they are having lots of interrupted sleep, and obviously that's not sustainable in the long run. Sometimes people need overnight replacement care so that they can have an operation or some kind of medical treatment. They might need to go and look after another family member. Or, you know, there are lots and lots of different reasons. Ideally, we'd like people to have holidays too, and to have, in the way that most people are able to get away and do something different every now and then, we'd like carers to be able to do that too. It makes a big difference to health and well-being. So the challenges in the care market at the moment mean it has been harder to secure replacement care that meets people's needs in a flexible way. If you're looking after someone whose needs can be met by quite a kind of standard domiciliary care provision, then most of the time we can get that at a time that's going to work for you and let you do the things that you need to do in your life. But if you're caring, for example, for someone with dementia, there actually isn't good enough provision at the moment in the city. We did go out to the care market a couple of years ago to block purchase a respite bed, but unfortunately the local care market wasn't able to provide what we were looking for. So that's a really significant gap. If you're caring for someone with dementia, you know, a lot of the time you are going to need an overnight break every now and then for the reasons that I've kind of described. In terms of entitlement to breaks, so carers have legal parity of esteem in the Care Act, which means that carers have the same level of entitlement to assessment of their needs and then provision of support if they're eligible as people with care and support needs do. And that was a really big legislative change when the Care Act came in 2014. Since then, case law has proved that carers are entitled to breaks where they are eligible, and that break needs to meet their needs. There's also a lot of policy around this. So Carers UK are the main national carers charity, do an awful lot of research, and their research has really shown that this is a national issue, that most carers are unable to access the support to have a break that they need. And the case law has borne out that actually this is a legal entitlement. So, you know, this is a problem, as Andy was talking about, in terms of the care market. Generally, this is a problem across the country. So staffing is a problem. The range of provision is a problem, not just in relation to dementia, but where people have quite specific needs. Say you're a person who looks after a spouse who has a complex mental health condition, but you also have children. For you to be able to get a break, you need someone who can provide care and support for both your spouse and your children. So that's often quite tricky. We have been able to find solutions through personal assistance in some of those types of situations, but again, that relies on the right personal assistant being available. Portsmouth Carer Service is based within adult social care, as we mentioned, and is a well-established carer service, and because it's within the local authority, it means we have quite a nice joined-up way of working and supporting carers across adult social care. That works quite well. When the breaks offer was first established, it was quite generous. Carers can access up to £150 once a year through an assessment. This is so if they're assessed as eligible. So a one-off payment of up to £150 once a year to go towards paying for anything that would constitute a break for them. That might be going out for coffee with a friend. It might be paying towards a gym membership. It might be equipment for your hobby. If you love fishing, just as an example, you could buy your fishing stuff or your license, you know. It's really quite flexible. We also provide payment for replacement care of up to 6 hours a week, equivalent to what is called a sitting service. It's a bit of just an internal technical term. It just means replacement care in the home to be with the person that needs care and support. And that, at this point in time, isn't chargeable up to 6 hours a week. But as I mentioned, that only works well if you can find the right person to provide that care and support. We have block purchased 2 respite beds in a local nursing home for planned overnight breaks. Prior to that, there wasn't really provision for people to plan a holiday or an operation in 6 months' time. Most private nursing and residential homes won't take bookings in the future, so that's why we have those. But again, if you care for someone with dementia, where that's the main thing they've got going on, it's not the best setting for that. And there are also a range of activities that happen at the carer centre and elsewhere, where carers can get peer support and a bit of time out. So that's just a little overview of the type of breaks offer that exists in the city at the moment. I think that was most of what I was going to cover, but let me know if you have any questions.
Thank you so much. Panel, do you have any questions at all? Yes, please, Councillor Madden.
Yeah, thanks. Thank you very much for that. And it's just referring to the paper that you sent out, Claire, and of course you've covered a lot of the points here, and the career breaks. And I think I'll come to a general point about the take-off, because it's increased, but I don't know whether that means that there are still 1,000 people out there who can't get them, you know what I mean? There's people applying for them. But the non-chargeable, could we just go to the first bullet point there on the second page, a non-chargeable one payment of up to 150 quid. I can see, I can see that is helpful, but we're saying that it presumably hasn't kept up with inflation or whatever. So what would carers or people getting care have to do then if they're on benefits with it? Say they want something for like 250 quid, say, whatever. Would they have to fork out the 250? 100 quid, say?
Yeah, that's correct. This is how it's set up at the moment. So Andy and I lead the regional network of carers leads, and I can say that there is a lot of variation across the country as to how carers breaks are supported. In some local authorities you would get more as a one-off payment, but you get a lot less in terms of non-chargeable replacement care. So this is how it was designed some years ago, but you know, it's kind of, I can't remember exactly how many years, but it must be at least 10 since this has been reviewed. So I think, as you say, it hasn't kept up with inflation. It's always been the case that £150, you know, it can't buy you a whole holiday or whatever. It might be able to buy you a night away. But as you say, you know, prices have really increased, and in terms of a gym membership, it's probably not going to cover a lot, for example, now. So, yes, carers would have to pay for anything else above and beyond that. Not all carers want the 150. Lots of carers just want a new pair of running trainers or something, although I understand they're expensive. You know, so it's very variable. Some people will just want 50 quid, but a lot of people do have the 150 now. It's just doesn't buy you as much as it used to.
Could I just ask, I have a series of questions, if that's all right, Chair, but on that, do carers have to apply for the 150, or do we give it to them?
So any provision of breaks, financial provision, is agreed through a carers assessment. So that's a Care Act, an element of the Care Act as I was describing. So as a carers assessment in Portsmouth can be really very straightforward. There's no form to fill in. It takes the form of a conversation in a way and at a time and in a place that suits that carer. If the carer has a reasonably straightforward caring role, it doesn't have to be a really lengthy conversation. We just need to understand what's going on for you, what works well in your life, what doesn't work well, and what might help. There are a few statutory things we have to cover, such as are there any young people in the house who might be affected by the caring role, and whether people are willing and able to continue the care that they're providing, because obviously that's not always a given, and it's really important that people know that they're able to kind of say, well, I will do this, but I won't do that. So in terms of then agreeing what that carer needs to be able to achieve a break, if they need some financial support to do whatever activity it is they want to do, that's the point at which we would start talking about the one-off payment. It's provided via a prepaid card, like a direct payment. So it's a reasonably straightforward process. Does that answer the question, Councillor Madden?
Yeah, that's fine. That's fine. I'll come back to a few points you made earlier on, if that's all right. So that'll be the same then for replacement care of up to 6 hours. So someone can pay for more than the 6 hours. Okay. Do you think, you said that on the first bullet point there that £150 is not as good as it was 10 years ago, let's put it that way. Would you say the same thing about the sitting service, the costs?
So the sitting service cost isn't capped. It's the sort of, the 6 hours is the way that we kind of work out what's reasonable in terms of replacement care. Lots of people above and beyond that who have care and support needs will also have their own Care Act assessment for the person who's receiving the care. So lots of people might also have a package of care alongside that for example, their personal care needs or whatever else it might be. So often the 6 hours is part of a kind of patchwork of other support that's going on, but obviously that's dependent on individual circumstances. Lots of people also who self-fund their own care and support, they can still access the up to 6 hours sitting service. The idea behind the 6 hours sitting service or replacement care is that it's a preventative measure. We know that carers often don't prioritise their own well-being and having time to themselves. So this is our way of kind of encouraging carers to do that.
On the third bullet point then, chargeable access to respite bed. So if the carer would like to, whether the carer to go up to respite bed, that is totally chargeable. There's nothing toward the council doesn't give any money towards that.
So that's chargeable at the local authority rate, and that will be chargeable in line with someone's financial assessment. So that's more like the provision of a care package direct to the person with care and support needs. So it costs less than it would if you were going in just as a kind of private client, and people will be charged an amount based on their financial situation.
Could I just, you mentioned that carers, or those being cared for, I'm not too sure which, have and it's a term, a legal party of esteem. I take it that means they've got to be treated on equal terms, or does it mean more than that? Is there a bit of a people going another mile under this? So I'd never heard this one before, I have to say. So could you put it in sort of non-legalese terms, what in fact it means and how people benefit from it?
Well, I will try. So prior to the Care Act, carers could request a carer's assessment, but it didn't have the same legal standing, and the onus was on the carer often to be asking for that. A carer's assessment very often was sort of tagged on to the assessment of the person with support needs, so carers weren't getting an opportunity to talk about their own needs, their own situation in their own right, and having that separate conversation that's about them. Since the Care Act, and Andy, please feel free to chip in, carers have this this parity of esteem is like an equal standing. So there's carers and people with care and support needs, and they have the same level of entitlement to assessment and support. So prior to the Care Act also, carers, there was nothing around are you willing and able to continue with this caring role. So a carer could have been caring 24/7, and hopefully this wouldn't have happened, but caring 24/7, not coping, their health might have been deteriorating, and a social worker could have said, well, you're doing it, so you'll have to keep doing it. I mean, I really don't think that was happening regularly in Portsmouth, but now with the Care Act, there's a legal thing. We have to ask people, are you willing and able? And if a carer says, I'm willing and able to do the medication, to do the meals, but I am not willing and able to do the personal care, then it's up to the local authority to then assess the person with care and support needs and, if eligible, provide that support rather than the carer having to do it. Is that any clearer?
If I might add to that, Councillor Madden, so I think the parity of esteem, what we've seen over time is a gradual greater recognition of informal carers. And I think whilst we've had policies and we've had various grants at a local authority level, prior to the Care Act of 2014, it was never set out in statute that people had a certain entitlement. We've seen that move on as well recently. In this year, we had the Health and Care Act of 2022, which created integrated care systems. And that contained a clause that said when somebody's going to be discharged from hospital, if they have an informal carer, the hospital should work with that informal carer and give them notice. So it's a gradual increase of rights, I think.
Yeah, must work with the carer.
My apologies.
That's fine.
If that makes sense.
Yeah. There were a lot of shoulds before, and now there are more musts.
I've just one last point, if I may make, just for the... I think Claire, when you started, you did say, and it's probably an obvious fact, that other local authorities will do funding in a different way. Could we have some examples of that for a future meeting? Just to see what local... Is that okay? Thank you.
Thank you, Councillor Madden, and thank you, Claire, for your responses. Are there any other questions from the panel at all? Councillor Brown?
Thank you, Chair. Claire, probably best to address this to you, I think. So obviously, where someone is a paid carer, they're obviously employed and there are records and we know exactly who they are. If we're looking, obviously, in this investigation to look into the provisions for unpaid or informal carers, I'm guessing there isn't like a set register of all informal carers. How difficult do you think it's going to be to get enough of them to come and give evidence to the committee to get a representative sample of the challenges they're facing? Good
question. The carer service is quite well established, and we are working with, I don't have the number off the top of my head, but around 1,000, 1,500 active carers at any one time. So, and I think that carers who are struggling to get the breaks that they need to keep them going will hopefully want to share their experiences. It's tricky because there are a lot of consultations and engagement exercises and people get a kind of consultation fatigue. But I think through the carer service, we can target people who we know are not getting quite what they need. The downside of that is it's harder to hear from carers who are not known to services. We can try and do that maybe through some publicity. There might be carers who follow the Carer Service Facebook page, for example, who aren't actually engaged with us. People might know other people. So we have been trying to improve the data around carers in the city. Through the vaccination programme, we got agreement for the Carer Service to be able to put the carer flag on the GP part of the patient record, because we have a shared record system. So we are gradually improving both the visibility and the data, but obviously that's a bit of a long-term thing.
Just to follow on from that, I suppose the people who actually need the help the most are probably the ones who don't know where to look for it and aren't engaged, and they're probably the ones we need to hear from the most and are going to be the hardest to get hold of.
Yeah, very true. Some research by Carers UK, I think something like 93% or something of carers had seen their GP or spoken to a GP in the year previous to that survey, but only 7% had been identified by their GP. So we do think health have a vital part to play, health of the people seeing carers day in, day out. We have gradually improved the awareness of our health colleagues, and we think there are some opportunities through the new integrated care systems where health is going to be more integrated, or is now more integrated with social care. But identification is certainly a big challenge. I think for the purposes of this, there will be people who will have experiences and will be able to share those experiences. But for data, generally, there's definitely more work to be done.
And one last final thing, I suppose, carers don't exist in a vacuum. So if someone is providing informal care for a friend or relative of theirs, they may very well know other friends or family or neighbours doing the same, and the neighbours may not necessarily be engaged. So sort of trying to find that organic reach through their own informal networks is probably a useful tool to use.
Yeah, definitely. And through employers as well. The greatest proportion of carers are of working age, and many carers are also working alongside caring. In the public sector, some parts of the public sector, it's estimated that 1 in 3 members of staff are a carer, particularly people who are care workers, where there are flexible hours and things like that. So I think there are other ways we can reach out as well.
Thank you.
Thank you, Councillor Brown. Councillor Symes?
If you find it difficult to turn up to these sessions, would they be able to speak to us through a video link? You know, if they can't leave the person they're caring for, that might also prove difficult for them, mightn't it?
Yeah, I'm sure we could certainly arrange that. We have done some sessions for carers through the carers service via Zoom and Microsoft Teams, so that's definitely something we can explore.
Thank you, Councillor Symes. Do we have any questions from... Yeah, Maria first, please.
I've been thinking recently about the people that are in hospital and can't come home because there's no care package or there's no actual proper carers to look after. But what if it's a husband or wife at home? Could they not be supported with a little bit of basic training to be a short-term temporary carer?
I think this is something that has been explored, and there was a sort of push for this, wasn't there? Was that earlier this year?
Yeah, I think it's a mix, really. We look into this fairly regularly, and there are sometimes concerns from care companies about what they call doubling up, working with an informal carer around whether their insurance will cover them. I think they're legitimate concerns, but I think we continue to pursue that. We certainly have in the past, some of our occupational therapists that we employ have worked with people to ensure they can provide safe care, because often you're talking about moving and handling for people. People may use a hoist, or equally they may need support to get up and down from chairs and beds and sofas and the like. And so wherever we do that, it's trying to make sure people can be safe and not cause themselves physical harm. I think but you raise a very relevant point at the moment, especially in terms of hospital care and people being able to get home. There's a lot in the national press around delays in hospital, and there's a lot that lays that at the door of not being sufficient social care. It is a mixed picture. Whilst undoubtedly the impact for social care of being able to provide enough people, enough carers, paid carers, does have an impact on hospital discharge. It's not the only reason that people are delayed in hospital. And in Portsmouth, we had a period in this calendar year where we had a great difficulty in identifying care in the home for people to return home to. And some people ended up staying in care homes because we couldn't find care in their community and there was no alternative. But at the moment, we are managing to source enough care that if there is a delay, it's a short delay. So we might be in a better position than other authorities, but that's certainly something we explore with people.
Thank you, Maria. Yes, please.
Hi. So also, Maria, you've got to think about whether or not the partner is going to be well enough to, so like you said with the husband and wife, if it was the wife, the husband might not be fit enough to do it himself. But that is besides what I was going to ask or say. I think there's a really big stigma about being and needing carers. I know my husband's my carer, he'd never admit it, but I think we need to work on that perception and make it less taboo topic to discuss. And then, is there anywhere that you can get information and support for people that are not in denial, but they kind of won't admit that, you know, they need or have or are a carer. Yeah, I think that's it. Thank you.
So the approach that the carer service tries to take, and it's tricky because we're called a carer service, is to say more like, do you look after someone? Do you help someone in your daily life with, you know, X, Y, and Z? So we try not to label as much as possible, but it's so difficult, obviously. I think we're actually just developing our website to be a bit better than it has been in recent years. And there's a sort of Are You a Carer quiz. But obviously having that conversation with someone, you need to get them into that conversation in the first place, and that's really tricky. I think the national media over the course of the pandemic were doing a lot of clap for carers, and they meant people who care generally, and that, you know, I applaud that. But you know, there was not really any coverage around family and friend carers, unpaid, informal carers, whatever term you prefer. And that, you know, I think a lot of carers felt really unseen. Even prior to the pandemic, I've heard carers talk about feeling like the ghost in the room. I think, again, a lot of this lies at the door of our colleagues across the public sector, and particularly in health, and that's tricky given all the pressures on our health colleagues at the moment, but where we hopefully can encourage a broader range of professionals to have that "are you looking after someone" conversation. What impact is that having on you? Have you thought about getting some support for yourself so that everything works a bit better? I think that would have a really big impact. So I think it's almost, you know, if we had a big media budget, then obviously we might be able to make some impact, but I think more powerful is those sort of regular interactions with people from across the system.
Okay. Andy, yes, please.
I think the other thing, and you're absolutely right, for a variety of reasons, people may not want to be identified as a carer. But I think the other thing that we're seeing, and this is a societal shift, and it partly refers to something Councillor Madden was talking about in terms of parity of esteem. We're seeing more and more acknowledgement, and the time of high employment that we're in encourages that we as employers, anyone that's an employer, needs to understand their workforce and understand their workforce's needs beyond just being an employee. And so we're seeing a lot of advances, or certainly a lot of discussion leading to some advances around how we work with carers in our workforce. We often talk about carers in Portsmouth. Claire was just saying we know about 1,000, between 1,000 and 1,500. I think the national estimate, there will probably be around 7,000 in total in Portsmouth. So we don't know the majority, but their employers might. And as we make it easier for people to work more flexibly, to suit their lifestyles, to suit informal caring, then we move away from having to identify yourself to just treating you as a member of the workforce. At the moment, we're in discussion with our cabinet around a private members bill that's going through the House around unpaid leave for carers, and there's a lot of support for that from Carers UK, which are the main organisation that speaks for carers in the country. We've talked already about that right to have an assessment, which wasn't there a couple of years ago. We identify in the council, and we understand that over 50% of our staff live in Portsmouth as well as work in Portsmouth. So that demographic of carers will be represented in our staff as well. So as we as employers become more enlightened about this and start to have different conversations, we start to make it easier for people to identify in whatever way they want to as carers and give them the support they need. Thank you, Chair.
Okay, thank you. Yes, Leo.
Yeah, just a further question. I hope that there isn't a stigma. I really do. But we'll have to see. We'll get a paragraph in the report dealing with that and what the council does with that. Because I do think when Claire was announcing earlier on and stating it, the amount of voluntary work done by carers, you know, and the billions that actually save the economy, if I can put it that way, yeah. I say that as a lead-in to the hard-nosed economy bit in relation to the last paragraph here, which is the future. I mean, so we know the £150 towards break and that sort of thing, and that's something we can look at, and we'll get a bit more information on that. It's not surprising, clearly, that the number of applicants now for breaks is 40% to a particular date, because people haven't been doing it, presumably, in the during the COVID period. I don't know that I'm going to have to say this, because whether we like it or not, I was a cabinet member for Social Care for a while, but for everything with the council and every other public body, it's money. You know, it does come down to money at the end of the day. And I do get residents deal with problems. Don't say anything about money, Leo. Don't say you can't afford it, you know. And I say, well, we have to put it within a context of everything else, right? However, the 40%, have you been able to cater for the extra demand that there's been? That's the first question. And the second question is, and I think it's a good point, and sometimes when things like COVID happen, you need to do it, to think creatively how to support in future. So there's the current one, are you financially able to do it, and people haven't been turned away for starters during the current applications that people have, and just give us an example if you have. I think you might have given one earlier on about thinking creatively for the future. Thank you. Thank you, Chair.
So it's been quite tricky to keep up with the volume of new assessments. We did have periods during the pandemic where we were supporting fewer carers but more intensively. So that's kind of what it looked like over the course of the pandemic. The service opened completely normally in March of 2021, back to normal, but obviously some of the services that people had been accessing prior to the pandemic had changed or didn't restart, some of the informal carers groups, things like that. So things do look a bit different. As I mentioned, there are more carers providing more care, so where people's care and support needs have increased, then they might need more support than they had prior to the pandemic. So there is a bit of a waiting list for carers assessments at the moment, which is not usually the case. We normally are able to offer a carers assessment conversation really very quickly, within a couple of days, if not on the day. And at the moment, I think it's around 3 weeks of a wait, which is not too bad compared to other waiting lists, but it's not how we'd like it to be. Very often carers do come to us at a really low point, and we like to be able to respond as quickly as possible. In terms of providing the replacement care, it's not been too much of a problem, but that's with the caveat that it's against everything else that's going on in terms of the care markets, and we might be able to, as I was talking about previously, provide a certain type of domiciliary care support, but that might not be ideal for that person, and that might mean that they give it a go and then they don't want to do it anymore. So it's in terms of the increase, in terms of being able to provide support, it's not as bad as it could be, but it's certainly not ideal.
Thank you.
I think in terms of the future, there's certain things that we can do as a local authority. There's services, the way that some of our services are structured, we can do some work to make them more accessible to people. So, for instance, rather than thinking in terms of, I don't know, a week's break that involves overnight stays and that kind of thing, we can think about a couple of days, a weekend, an evening out, whatever it might be, and that can help people care. So there are certain things that we can do. There's always things that we can do better, I think, as a local authority, and we'd always agree with that. I think what Claire's said is particularly appropriate, really. So we've got a waiting list. The system, I think, is creaking. We wouldn't normally have had to wait for a carers assessment. I think the picture in Portsmouth is reflected nationally, and that we know nationally from a recent survey by the Association of Directors of Adult Social Services, we have 500,000 people who have care and support needs who are waiting for an assessment and support. Not carers, but those they care for. The same survey asked directors of adult social services to how confident they were they could meet all their statutory duties, and 9% of directors of social services said they felt confident they could meet their statutory duties. So conversely, 91% didn't. So I think what we're seeing a national picture of a care service that is under strain. I think that's been well represented. Locally, there are always things we can do better, but I think they're tweaks, if you like, rather than wholesale reform. Maybe that puts a bit of context around the future.
Thank you.
I could just reply to this, and yeah, Sam, Andy, you're absolutely right, and that's what I'm saying. Even if we had the same financial footprint, i.e. this is what is spent in that, obviously we'll be putting recommendations in, I suspect, to increase that, but nevertheless, if that's, what could other things be done within that to help people? And of course, the people who could tell us are the carers, really, aren't they, and people cared for us to what they would like, within that. So there might be maybe shorter breaks or whatever, I don't know. Could I just ask a question? Does anybody know of anybody who's taken up the one of the 2 respite beds ever as a break? I have not come across anybody. Anybody know? Just a matter of interest. Is there a big take-up on that, Claire?
So prior to the pandemic, take-up was pretty good. Both beds were pretty much fully booked. Over the course of the pandemic, obviously the way that nursing homes were affected meant that they generally weren't admitting people, and demand was almost nothing. People just did not want to engage with that type of support, understandably. Since the pandemic, it's been a bit of a mixed picture. Bookings were quite slow to grow, and then when people had bookings, quite a lot of them got cancelled for various reasons: COVID outbreaks, other virus outbreaks, and illness on behalf of the people who were due to be going in. So the respite beds definitely need reviewing, and that's very much on we're planning to do that and hopefully do something different from next year. I'm afraid I don't have the figures off the top of my head, but I can get them for you. But take-up is very, very much lower than it was prior to the pandemic. Just to add to that, actually, when the beds aren't being used for carer breaks, they are often being used by colleagues in other parts of the service. So they might be for continuing healthcare admissions or something like that. So although the beds haven't been used consistently for carers, they have been used for other things.
Thank you, everybody. Are there any further questions? No, thank you. That's a really meaningful discussion. I think from that discussion, it's quite clear that it's vital that the voices of our unpaid carers are heard. I just have one question, and I heard you say something around when carers have the assessment, if their finances are over a certain amount, they might not be accepted. What is that cap, please? And if you don't have the figures right now, please, can you send them to us? Thank you.
So for the £150 one-off payment once a year, that's not financially assessed, and the up to 6 hours replacement care sitting service, that's not financially assessed either. So anything beyond that is assessed, so that the respite beds and anything else that would constitute really more of the care package of the person with care and support needs rather than a carer break, and I appreciate that's a fine line, that's almost like an administrative kind of separation for our purposes, that would be assessed in line with the adult social care, the rest of adult social care.
So we follow national guidance around charging. So we make an assessment of people's financial circumstances, and that takes into account any capital that they may hold, their income, interest paid on investments, anything like that. And that the calculation that we use leaves a person with a certain amount of, or disregards rather, a certain amount of income. And then they're charged for their services if they have above that level of income based on their own individual circumstances. So charges will be very much on individual circumstances. There are occasions when people will pay the full cost of care. So let's say, for instance, a nursing home bed is, I don't know, £700-800. If they've got a certain amount in capital and income, they may be paying that directly. In Portsmouth, that tends to be a lower number because we are a city of high deprivation. We're not a city of wealthy people. And so what you often find is there is a charge, but it's not the charge of it's not the full charge of the service. So it's very much dependent on individual circumstances. But what we can do, if it would be helpful for the committee, is get a more detailed explanation of that and do some bandings so that you can see examples of what people might be charged.
That would be really useful, thank you. Okay, so we need to move on to agree the scoping document. Have you all received a copy of this and had a chance to look at it? I'm just going to... No, you haven't. Maria, have you got one there? Yeah. Okay, yeah, thank you for bringing that to my attention at the beginning. We will make sure in future that you do get the paperwork, and I'm sorry that you haven't received it in time for the meeting.
Chair, could I suggest that it's so short you read it out, because there may be people watching who might be interested in...
Thank you very much for your suggestion,
mind,
Leo.
yeah.
That was exactly what I was going to do.
There's something about great minds?
Oh, something like that, yeah. However, before I do that, I would like to make an apology because we went round and did the introductions and I forgot this lovely lady over here. So on that note, Anna, could you just introduce yourself at the end of the meeting?
Anna Martin, Democratic Services.
Thank you, Anna. It's always a pleasure to have you here. So just to read through the document, because it is so short, and as Leo said, for the purposes of people that might be watching at home, the working title is Review into the Provision of Breaks, Respite for Informal Carers, particularly those who care for someone with dementia. The objectives: the review will consider the provision of respite for informal carers, especially respite for dementia care. Possible witnesses, so Andy Biddle, Director of Adult Social Care, and Claire Ratchwell, Deputy Head of Service for Market Development and Community Engagement. That is a mouthful of a title, isn't it? Informal carers, obviously, and external organisations such as voluntary and community sector and or care agencies, with a timeline. So mid to late September, agree scoping document and timeline. Mid to late October, 1 or 2 meetings with informal carers in person or virtual. Early November to early December, 1 or 2 meetings with more formal providers of respite, such as agencies and voluntary organisations. January to February, any other meetings if needed, and early March sign-off. So, are there any further suggestions for the document? You certainly can, Councillor Madden.
No, it's just, I agree this is the document, but just a bit of meat on the informal carers and how we'll contact them, who will contact them, and well, we can go to see them if that's what they want or whatever. I think Linda asked that question earlier, but how do you see that playing out?
Yeah, well, I'm hoping our officers will be able to support us with that. And I think there was some talk as well for those who are unable to meet in person that we hold it online as well. I do have a little concern around, because I know, I think it was Councillor Brown mentioned about the carers that go unnoticed. Everybody who is an unpaid carer, do they well, I certainly know that I've had residents when I've knocked on the door that have been carers and they weren't aware that they could get carers allowance. And I do, again, have concerns that there are some people that are really slipping through the gap here, and I think that needs to be highlighted too. So that was just an add-on to what Councillor Madden said.
So I think in terms of contact with carers, we'd probably use the Carers Centre. As Claire was saying, we know about 1,500 folk in Portsmouth who are carers, and I'm sure we can do either virtual or face-to-face. We've got the Carers Centre as a base, which is quite helpful. I'm sure some of our carers would be happy to appear as well, if we can provide them with support. In terms of carers allowance, it's a continual issue. I think it goes beyond carers in terms of, we know the take-up of benefits, people that are entitled to benefits in a year, there's millions of pounds that aren't taken up. We do publicity campaigns now and again. We do have social media. We can do that again, and we do quite a lot through the Carers Centre. But Claire, do you want to come?
Yeah, so the 1,000 to 1,500 are the carers that we're actively working with at any one time. So there are more carers who we can reach through the Carers Centre newsletter, through our social media, through the carers support groups that exist in the city. There's a network of the volunteer leaders of those support groups. We could ask our NHS colleagues and colleagues from the Hive and Health Watch to put stuff out through their communication channels as well. There is a good kind of fairly well joined up kind of group of people who will collaborate on things like this and get messages out as far and wide as possible. So yeah, hopefully we could reach quite a good number.
Thank you for your responses. Do you have any further questions, Councillor Madden?
No, I just think we should give ourselves a bit of leeway, because you're right, there are carers out there who don't know provisions and all the rest of it. You know what I mean? And yet we have carers. To say, I dealt with an issue recently where the carer said, "I've just been sent something about caring allowance." So that came from somewhere. So I don't know when people get into the system somehow or other that were informed and didn't know what it felt actually a bit. I didn't like the idea of it. Didn't think they needed the money and all that sort of thing. Well, I explained to them, it was the entitlement and a government thing. So I'm just wondering. Let's see what the first batch, in case. I think there's a bit of allowance there for anyway to see, because I would like people. I'd like to know if there are people there, and a lot of them, who don't know how to access it. It'd be interesting to find out why. And I might say, well, I don't read all this stuff, and I'm not really interested in it, but it'd be interesting to know that, wouldn't it? If needs be, Chair. Okay.
Thank you. I do believe that the document is subject to change as we go through, so if there is anything that crops up from any conversations that we have with voluntary community sectors and with the informal carers, then we can certainly add to the report. I think that's correct. Yeah. Okay. Yes, please, Maria.
Just a quick one. I'm sure that there are probably people who are carers who don't even know that they're carers. The person who helps somebody get out of bed in the morning, get dressed, give them the time. Well, that's my wife. I've been married to her for 40 years. She's always taken care. So I'm sure that there must be a lot of people that perhaps through publicity we can get in touch with them, because there must be people who are caring and don't know.
Very well said, Maria. Thank you. Any further points to be raised? No. Well, in that case, then I think we've all agreed on the scoping document. Do we have any objections? No? Brilliant. Thank you very much, Andy and Claire, for coming along, and thank you to the Residents' Consortium representatives for joining us today. In terms of going forward, Anna, would you be able to set up the meetings along with Andy, myself, and then we can send it out to the rest of the panel and make sure that everybody gets the documentation that they need before they come to the meeting? Is that okay going forward? Excellent, thank you. And again, thanks for coming, and have a lovely weekend. Thank you.